Hello leaders, this video is just for you. I have been to many milongas and festivals where leaders are complaining of foot pain. Yes, foot pain, even though they're not wearing heels. Knee pain, hip pain, back pain. Those are the predominant areas that I hear about. In this video, I'm going to go through each joint from the bottom up and probable causes and contributors to the pain. Now, a lot of you may have had different injuries over time due to other things outside of Tango. Maybe you've even had surgeries like a meniscus surgery or a back surgery, or you're dealing with something like a herniated disc. Know that all problems are not equal. Every herniated disc is not the same. Every meniscus tear is not the same. So it's important that you get whatever pains you've been having chronically checked by a medical doctor. And then they might send you to a physical therapist who can give you some baseline stretches and cross-training exercises to do, and who can also give you some do's and don'ts as far as these are exercises that would not be good for your condition that could actually make it worse. So it's always important to know exactly what you're dealing with before moving on. So let's get started. I have zoomed in on my feet so you can see better what I'm going to demonstrate. If you're in a very crowded room and you don't have a lot of space, I see a lot of leaders sliding their foot on the floor. They don't have to move very much, especially sliding their foot on the floor. And then also doing some weird things to lead as far as the outside of the foot. Sometimes they'll roll to the inside and out of their outside of the foot, rather than picking their foot up. If you haven't watched my foot and ankle exercise video, do. You should be doing some cross training to get your toes and your feet moving the way they should before you dance. So even if you're in a close, crowded space, if I'm going to take little steps forward, there should be an articulation of the foot, heel to toe. So that way the underside of the foot is moving as it should. I should not be sliding because that's going to tighten up the plantar fascia. The rolling to the outside and the inside is a compensation again for not wanting to move the foot. I'm stepping to the side. I'm stepping to the side. Okay, if I want to move with a woman that's doing ochos and I don't want to stand and do rotation of the upper body, I need to move with her by actually lifting my foot. Frequently I'll see the shuffle. Okay, and that's going to lead to foot pain. So remember that even though you may be taking very small steps and staying within a very small space, you should have full contact with your foot on the floor without rolling one direction or the other. And you also should not be shuffling your feet. On top of that, cross-training exercises. The toes should move, the ankles should move properly so that when you go to dance, your foot is ready to go. The next joint I'd like to briefly talk about is the knee. I'm wearing these jazzy pants so you can see, okay, when I'm twisting my legs versus my legs are staying still and I'm twisting my body. The important thing to know about the knee joint is it takes a lot of shock absorption, okay? So if this is my femur, this is the upper part of my leg, and this is the lower part of my leg, just with gravity withstanding, the joint compresses. When you sit down, there's no pressure on the joint. When you're in a pool, the buoyancy reduces pressure on that joint. But for weight bearing with gravity, that joint gets compressed. If you twist with that compression, okay, so I'll be showing this closer up, you will be causing more problems. Ligaments that have been overstretched and compromised by other things. You have a meniscus tear. You have an unhappy knee joint. You're having knee pain when you dance. Take a look at how much twisting you're doing at the knee instead of your body. If you haven't looked at my dissociation video, you should. It's all about keeping the lower body stable as the upper body moves. Okay, there are certain things as a leader that we could do standing still and lead with the upper body. But all too often, I see the whole body twisting and moving. So let's zoom in. All right, I'm zooming in on my legs so you can see, and this also pertains to the hip joint, so I'll move back a little bit. So hip problems, again, compression, rotation, really unhappy here. So if I sag in through my hips, see how my knees come together? So you need to do some cross training for the lateral hip muscles to pull up as you're standing, so knees, hips, and feet are in one line, not there, sagging. Especially important when you're standing on one foot. A lot of times people stand on one foot and they sag. You see how the knee is now going that way? You should be pulling up. My body alignment video talks about this a bunch, so you might want to check it out. So whenever you're standing doing a lead, the upper body should be moving, not twisting the lower body. All that twisting is going to upset your knees, and it's also not great on your foot. You see me rolling my feet back and forth. Okay, so bad technique there. If anything, you should be moving the foot. I move the foot for the ocho cruzado. I move each foot, and my knee, hip, foot stays in alignment. If I do that and I sag in through my hips, my knees will be coming together. So you need to pull up through the hips, practice some balance exercises. I'll have a video for that, and maintain knee, hip, foot alignment when you dance. The last area I'm going to briefly talk about is the back. As a lead, we have our left arm up, the right arm is around the follow, and we're usually inclining some toward the follow, okay? Especially as we get going, sometimes more than others, but in general, we have that little arc of the back. So this side, the right side of the back, gets stretched. The left side of the back is contracted for the length of a tanda. All right, so you're talking 12 to maybe even 20 minutes in this position. Very few leads alternate. That would be a good thing to do just so that you're not stuck on one side the entire night. So maybe follow a little bit, that would help. The other thing that I see is pitched forward the waist. I know some teachers actually teach this, especially if you're in the milonguero style, that you're slightly pitched forward at the waist. That puts a lot of pressure on the lower back, okay? So if you're maintaining that for an entire tanda, it's important to do some cross stretching when you're not dancing so that your back muscles get a break. You do some rotation, you get a little back extension the opposite way going on. Yoga is a great thing to do. However, if you try to stretch in a yoga class and you haven't done any stretches for 10 years, you're going to get hurt. So again, talk to a doctor first if you're having pain, check it out, make sure you know what you're dealing with. Go see a physical therapist who can give you do's and don'ts, like, ooh, you have a herniated disc and it is in the rear and it's to the right. Therefore, if it's in the rear and to the right, the more things you do forward and to the right are going to be making the problem worse. They will give you the do's and don'ts depending upon exactly what your medical diagnosis is, which will help give you guidelines so you could do stretches more safely and effectively. So let's face it, most milongas do not have chairs with good lumbar support. There is no lumbar support. And you're lucky if the backrest stays upright when you lean on it, right? So when you're not dancing and you're sitting enjoying the milonga, if you're sitting like this, talking to your friends, whatever, eating, or like this, that puts a lot of pressure in the back. And it's the same position as bending forward when you dance. Bending forward for long periods of time pushes the disc posteriorly. And at some point, they might get stuck there. So the last thing you want to do is lie on your back and I hear frequently, well, I do needed chest stretches. Well, look, that's the same position as sitting slouched. So maybe that wouldn't be the best cross-training thing for you to do. So, in the very least, pay attention to your posture when you sit. I talk about this in my postural video, my body alignment video, sternal lift, okay? Think about sternal lift. And don't overcompensate, okay? You don't have to put your shoulders back and strain, but to sit with the lower back curve as it should be going inward would be a good start in relieving a little pressure on your back when you're not dancing instead of sitting slouched. I hope this video gave you some good insight on things to look at if you've been having foot, knee, hip, and back pain as a leader. I cannot stress the importance enough of going to a doctor first, a medical doctor, orthopedist, a specialist, to take a look at wherever you're having the pain to get a handle on exactly what's going on. All too frequently, I see posts on Facebook saying, hey guys, I've had back pain and my doctor says I have a herniated disc and what should I do for this in Tango? That's not a good place to look for good medical advice. Talk to your doctor and say, hey, I'm a Tango dancer and I'm not quite sure what I'm doing that is making my pain worse when I dance. Can I see a physical therapist? And then they'll send you to a physical therapist, and the therapist will do a regular evaluation, look at your limitations, look at your exact diagnosis, ask them for do's and don'ts. What can I not do? What am I not supposed to be doing that will make this condition worse? That's an important question for them. And they should be able to look at your technique. Ask them to. Say, hey, I'm a Tango dancer and I really enjoy this and I dance on my feet for hours. Be sure that you let them know that you have stamina requirements for this dance. And show them what you do. And do not show them the best posture and your best form just for the evaluation. Show them the way that you dance. I like to cuddle and I'm here, so that they can give you some insight to maybe some modifications of your technique. Then you have to work on your technique yourself. So the best way to do that is to see your body. In Tango, we like to hide our imperfections. And so we wear pants that are a little bit baggier, skirts that are long. If we don't like our knees, we hide them. If you're having pain especially, you need to work in short shorts, in pair of exercise pants, bike, cycling shorts, something where you can see your body. And that is the most honest way to work on the problems. Oh my God, my knees are bent the entire time I'm dancing. You'll see it. You won't see it with really cool Tango slacks on. So film yourself, and you can do it just, in a private practica or in the comfort of your own home. All right. But it's important that you get a handle on what your body is doing when you dance and be honest with yourself. I hope this video gave you some great insights, and good luck with working on all of this.